So those vertical lip lines, well, guess what? They can appear even if you've never smoked. Here's an example of deeper ones here. The lines above the lips. A needle in your lips. Ouch, right? Today, exactly why they occur, and most importantly for you, a two-step approach that I use to address them effectively. No Botox, no filler. And you've seen or even tried maybe treatments like these. Yeah, they're the lines above the lip, and you can draw them with a little pencil. They're worse when you pucker, of course, eat or talk, which is a problem. And yeah, a lot of people can use Botox. That was a Botox style needle. And this is a cannula that you can put open laterally, a little opening, and then you put filler in there and you work it back and forth. And before we go on here, let me tell you a little trick in the industry that nobody tells you. The main culprit here is the vermilion border. This is the vermilion border right here. This collapses first. You lose lip volume from the age of about 22 or 23. Yes, but you see these lines right here? Well, when you address lip plumpness and that vermilion border, it supports the structure and it helps reduce them, even though they're above the lip. So the vermilion border. Keep that in mind as we progress. Oh, and yes, that's why fillers cause the ducky look. Everyone addresses the vermilion border, sometimes too much. Or you take a needle here and you just pointedly put it in lines. And look at this, derma stamping. And you can use mesotherapy type of treatments with that, but essentially you put a solution in that little holder and then you stamp it. And some people put a little bit of Botox in there just to get microtox. Now, yes, face exercises. You could use them and follow exercises, but often, as you see here, the person is 18 years old and no lip lines. Now, I love face exercises, but this is not going to work after 40 in this particular region, and I'll explain why. It's part of the process. It can help, yes, but it won't remove. You can see in this demo here, we have a nice anatomy picture up top, but no lines to begin with. Likely, that's not why you're watching this video. That's like trying to iron a linen shirt with your hands. Technically helpful, but not solving the real problem. Now, what about makeup? Well, as you can see here, yes, you can line the lips. The lipstick will often bleed, but hey, you live life. And what if you wake up in the morning, wake up no makeup? What if you're in the pool? What if you're at the beach? And it's not going to take care of the problem. They'll only get deeper with makeup. Makeup can play a role as you're doing the two-step process I'm going to talk to you about today, but it's not a fix. One of the biggest problems when people come into clinic is they say, hey, it happens at the worst time. I'm having dinner with other people. I'm eating and drinking. They see the lines. It's apparent to them because you're puckering. And a problem here, it's a one-way street. What do I mean by that? These never reverse on their own. They only progress and get worse. It's the nature. The good news, you don't have to live with them. Not today. Let's start with a powerful topical product. Easy, right? Then we're going to step up to a regenerative treatment. So the number one question my patients will ask is, hey, why do I get them even if I never ever smoked? It turns out it's a combination of several factors as we age. Collagen goes down, elastin goes down, you lose a bit of bounce. The skin, particularly around the mouth, well, it becomes thinner, less resilient. At the same time, the muscle around the mouth, orbicularis oris, it gets stronger. And as we lose facial fat, it becomes more apparent. Sun damage, dehydration, and daily lip movements all speed the process up. Oh yeah, I hear you now. What about makeup over the lip border? If you're younger, check this out. A possible solution. That's not going to work when we get older. And one last one that's not going to work, overfilling. Check this out.
9 problems that the lips ain't one.
It's so common. Injectors, providers, we overfill just to get rid of the lip lines. Not a great solution. Your step number one, something very simple and easy like this. not a needle, you might think, but these have applicators on them and they have topicals. And before you click away, they're not made like they used to be. If your lips are thinning, the border's losing definition, and lipstick isn't sitting cleanly anymore, it's just a little bit bleeding, these are your lip filler without the injections, and they now work. They deliver visible plumping effects in just a couple minutes. I'll go through ingredients with you in a second. And the effects last for hours, and there are longer term benefits that last for many, many weeks to months. So for you deep divers, what ingredients are you looking for and that I use in mine that makes it so popular and effective? No gatekeeping. Here's what you want to look for. Number one, niacin. That acts as your vasodilator. That increases blood flow. You get that instant fuller effect and a more vibrant red look. Then there's menthol and camphor. They create a pleasant kind of instant stimulation sensation that enhances the plump right away. Again, people love instant. Now here it is. These can now contain retinol. You want to look for that in there. Yeah, in a lip enhancer on your lips. Few people realize you can do that now. It can be done because we can time release it. So you don't get the inflammation and irritation that you might think, but you get the benefits of collagen stimulation, a little bit of increased turnover, better color, and it helps with the fine lines right on the lip itself. Vitamin E, a good antioxidant, and peptides. It's a buzzword right now, but palmitoyl oligopeptide is one that stimulates collagen and hyaluronic acid production, and that gives you that longer term plumping effect and protection to your lips. So no longer are you just getting a temporary cosmetic effect, you're actively helping the lips look smoother and healthier with continued use over time. And so if you're using them regularly, even weeks or months later, if you've stopped using it, you'll see benefits for having done so. In fact, we studied this exact type of formula in a trial, and it showed a 13.59% midline increase in pink lip after just one application. That's astounding for an immediate result. Now, I do add a little bit of tint to this one, but I just added a sheen to it, and women seem to love it, but it does have a nice look when you apply it. Only for viewers of this video, I put a link to 25% off if you want to try something like this exact one. It's pinned to the top of the comment section. It's in the more info section of this video, and it's 25% off for a limited time. Tell your friends, it's also an amazing gift item. Enjoy that. So if you're just starting to see lip lines or you're losing a little bit of volume, and we start to lose volume from the age of 23, 24, these type of products are perfect to enhance the lip and prevent those changes and reverse some of what you're seeing. No needles, no Botox, but data to back them up. Now, step number 2. As with all aesthetics, some people need a little more help than a topical is going to give. Step number 2 is plasma lip. That's a trademark platelet-rich fibrin treatment used with a cannula. You saw a cannula style injection that gal demonstrated earlier. That was more for filler, but you can use the same technique with a blood draw where you draw your blood, spin it down, get your own exosomes, mesenchymal stem cells, and growth factors all concentrated to put it back in your lip so it won't look like this.
Meet Vienna Extreme, an influencer, lip connoisseur, and walking FDA warning label. She's spent more money on filler than most people spend on food in 5 years. Her lips now operate on their own gravitational pull and might qualify as carry-on luggage. At 25, Vienna versatile, yes, like the sausage.
Why cannula, you're going to ask? Well, the lip is very sensitive, and if you just put an opening here for the cannula to put the product in, and you can put it above for vertical lip lines or into the body of the lip, so you address the vertical lip lines as well as the body of the lip. And just moving a cannula along where those lip lines were will help stimulate collagen, break down some of the connective tissue, and help stimulate a repair process. We call that undermining. The goal here isn't oversized or overfilled lips. It's natural regeneration of what you had. And of course, combining that with a lip enhancer, now that is the best of both worlds, of course. Combinations always win. We do that in Korea. And of course, you can add laser to all of this. This is an erbium YAG. You could also use CO2. But even if you do, you'll also need to add some sort of volumizer. Laser resurfaces, it does not volumize. So let's recap. For early or moderate lip thinning and lines, you want to start with a lip enhancer daily, and you can use these a couple times a day for immediate plumping plus ongoing support, circulation, and enhancement. For more advanced etched in lines or more noticeable volume that you need to restore, you want to use PRF, all natural blood draw, when you can. Now, some people are still going to need a little bit of filler after this, and if you do, no problem. Hyaluronic acid filler, you can layer it on top of the PRF. It will look better. The filler will look better for having done the PRF. It will last much longer and look much more natural than adding all filler that can migrate. That's the problem when you add too much filler. You talk, it's a movement zone, the filler migrates around the face. We don't want that. That's how you can prevent it. If you want to start with the first step, one of these, I put a link in the more info section below the video, and I pin it also to the top of the comment section. You can research this product. I put a special on there for you. And if your lines are more advanced or you're ready for the next step, I put a link to a locator where you can find providers that do PRF around the country, so you can find somebody near you. To make sense of this, you're going to want to watch this video on exactly how you can then incorporate red light to boost all of this for your lower face, lips, and gums to keep your skin and body beautiful, healthy, and vibrant.